GP or private clinic for ED. Here's what actually happens at each. Suggested delivery: calm, unhurried, knowledgeable, conversational rather than formal. Speak directly to one person. Slight pause after questions. Avoid rushing. Approximate length at a natural pace, 2 to 3 minutes. If you've been dealing with erectile dysfunction and you've finally reached the point of wanting to do something about it, the first real decision is usually this one. Do I go to my GP or do I go private? And it's a harder question to answer well than it sounds, because most of what you'll find online either pushes you toward one route without explaining why, or gives you information that's vague enough to be useless. So let me walk through both properly. When you go to your GP for ED in the UK, you'll typically get around 5 to 10 minutes. In that time, they'll ask about your symptoms, how long things have been happening, whether you still get erections at other times, and whether you have any relevant medical history. They'll usually arrange some blood tests as well, checking things like blood glucose, testosterone, cholesterol, and blood pressure, and those are genuinely valuable, regardless of which route you take afterwards. But then comes the treatment conversation, and under NHS guidelines, the first and often the only thing a GP can prescribe freely for ED is generic Semdetevil. That's the active ingredient in Viagra. It works by temporarily increasing blood flow before sex. It helps a lot of men. It doesn't work for everyone. And if you've already tried it, or you simply don't want to take a tablet every time you want to have sex for the rest of your life, the GP pathway doesn't have much else to offer at that stage. Specialist referral through the NHS is possible, but the threshold is higher than most people expect, and waiting times can be significant. That's not a criticism of GPs. It's just the honest reality of what the NHS pathway is designed to do within the constraints it has. So where does a private clinic like ours fit in? The starting point is different. At Male Health Clinic, the initial assessment is 90 minutes long. That's not a consultation designed to reach a prescription. It's a proper clinical conversation about what's actually happening, what's driving the symptoms, whether the cause is primarily vascular, hormonal, or psychological, because those things often point in different directions when it comes to treatment, and what you actually want to achieve, because not every man walking in has the same goal. For men where a vascular cause is identified, the core treatment we use is focused shockwave therapy. Rather than temporarily increasing blood flow the way a tablet does, shockwave therapy uses low-intensity acoustic waves to stimulate new blood vessel growth in the tissue itself. The aim is to improve blood flow at a structural level rather than just on a given night. Sessions are non-surgical, don't involve any medication, and most men describe the sensation as mild and tolerable. It's not a guaranteed fix for every man. It works best for mild to moderate vascular ED, and a thorough assessment is what tells us whether you're a suitable candidate before any commitment is made. We think that transparency matters, and we're upfront about that on our website, including full pricing. So to come back to the original question, which route is right for you? The GP route is a sensible starting point if you haven't tried medication yet, if you want the blood tests done first, or if cost is a significant factor right now. Go get the tests. It's useful information. The private route makes more sense if you've already tried medication and it hasn't solved the problem, if you specifically don't want a medication-dependent approach, or if you want more time with a specialist who works in this area every day and can go deeper into what's actually causing this for you specifically. The two aren't mutually exclusive either. A lot of the men we see come in with their GP blood test results already in hand, and that information is helpful rather than redundant. If you'd like to understand what a proper assessment involves before committing to anything, we offer a free, confidential discovery call. No obligation, no pressure, just an honest conversation about your situation and whether we're the right fit for you. The link is below. Come back to it whenever you're ready.